The information and opinions expressed in this podcast do not necessarily reflect those of ASRM and its affiliates. These podcasts are provided as a source of general information and are not a substitute for consultation with a physician.
Dr. Christos Coutifaris joins us on the podcast today to talk about the latest ASRM COVID-19 Task Force update.
Welcome to ASRM Today, a podcast that takes a deeper dive into the current topics in reproductive medicine.
Thank you so much for being with us today. If you would, could you please tell the audience a little bit about your role in the task force?
I'm a member of the task force from its inception when Dr. Rakowski and Dr. Aziz constituted the task force to review and then give periodic updates to the membership and also to patients and society in general on how we should be viewing the COVID-19 pandemic vis-a-vis the practice of reproductive medicine.
What are some of the goals of the task force?
The main goal is really to guide, to give information, and also at the same time guide the safe approach so that we can continue providing care, but at the same time safely providing care to avoid further spread of the pandemic to our patients and to the workers who are basically putting themselves at the front lines of treating patients with fertility issues.
Thank you. I want to now transition then to the actual update document itself. We want people, of course, to go and read the document that has been posted as of yesterday, October the 12th. Could you tell listeners a little bit about the current landscape?
The current landscape is unfortunately becoming a little scary again, even in that 1 week since we put together the document, although it was published only yesterday. The updated statistics show that almost 7.8 million cases have happened in the United States and over 214,000 deaths. And just in the last week, there were greater than 344,000 new cases. So this is pretty significant and indicates most likely that we are entering this second wave of the pandemic, which we have been warned about, but it seems like we never believed it was going to get here, but it seems that this is happening right now.
And just to clarify for listeners, the document was actually finished on October the 6th. Is that correct?
That is correct. In less than a week, in 6 days, basically, we had a dramatic increase in the cases, in the deaths, and new cases, which is really a sign possibly of this new wave that is indicated by the numbers.
It is most certainly unsettling in such a short time period.
We are also entering flu season, and this was mentioned in the last update, but it's very critical to mention it again now, because by symptoms, you cannot always distinguish between the two. So this could become a very difficult situation for healthcare providers. So a major recommendation, which is related but unrelated to COVID, is for everybody, both patients and healthcare providers, to get vaccinated with a flu vaccine.
What are some of the current recommendations that you'd like to touch on for the audience?
So we basically continue to affirm the previous recommendations, the ones that were sort of renewed in update number 3 when we opened up again practices, because if you recall initially, we had recommended basically ceasing reproductive care until we felt more secure that we knew what we were dealing with and how to prevent the spread. So from update number 3, which was in April, these were the same, continue to be the same recommendations. Open up cautiously with appropriate protections to prevent the spread, social distancing, hand washing, mask wearing, and so on. And in some special situations, even like in the operating room, even further strict guidelines in terms of mask wearing and so on and so forth. We know so much more about the disease nowadays than we knew in the spring, that it is helping us, I think, deal with a day-to-day practice with minimal interruptions of the practice. And I think this is to benefit our patients.
Thank you so much for your time today. I have one last question for you. Is there anything that you would like to add that you think the next update might likely begin to touch on?
The present update includes information which may be actually very important for everybody to read on the different types of tests that exist, including the point-of-care tests and their sensitivity and specificity. There are practices that may want to consider starting to use point-of-care testing, but they need to understand the limitations of such testing. It also provides an update on the vaccines that are being developed that hopefully in the next few months, so hopefully weeks, at least the results will be known to see if we can proceed with mass production of these and therefore start immunizing patients as we enter the next year. The three major vaccines that appear to be closer to getting the results from the clinical trials are mentioned in that, and that will be great information. And also there's information about therapeutics and what has been shown to have some efficacy, but more importantly, all the approaches that either have shown no efficacy or potentially being harmful, which we want individuals, both patients and physicians, to be aware of and therefore avoid them. So it's important for the membership and patients reading these to appreciate some of these advances that have occurred. Finally, I think it's important to talk about the mental health impact of this pandemic. And there is a major part of this update that includes how to manage mental health, both at the workplace, but also for our patients. And I would strongly advise the readership to read this in this recent update.
And people can find this most recent ASRM COVID-19 Task Force update at www.asrm.org. Doctor, thank you again so much for taking time out of your extremely busy schedule to be with us on ASRM today.
Thank you so much, Jeff, for giving me the opportunity for this. And I think this is very, very important, whether we are at work or at home or out in public. So therefore, wear a mask, social distance, and so on and so forth. If we lead by example, then others would imitate, and that would prevent the pandemic of continuing, hopefully. One additional comment I would like to make is I really recommend for our readers to review the part updating the laboratory guidance, as obviously the laboratory in a reproductive endocrine practice is extremely important, and the embryologists, andrologists, and so on need to be aware both of the developments, but also of the guidance of what is to be done during this pandemic. There is an update that is included and referenced in the current number 9 update published this week.
That was Dr. Christos Coutifaris, member of the ASRM COVID-19 Task Force. I am Jeffrey Hayes, and this is ASRM Today.
This concludes this episode of ASRM Today. For show notes, other information, and discussions, go to asrmtoday.org. This material is copyrighted by the American Society for Reproductive Medicine and may not be reproduced or used without express consent from ASRM.